Hello, and welcome to the Academy of Emergency Nursing's 2020 Induction Ceremony. I'm Vicki Patrick, the 2020 Academy Chairperson. As nurses, we are adapting and changing to the extraordinary challenges that confront us daily, both professionally and personally. In ENA's 50th year, our emergency nursing colleagues have been tested more than ever before during the COVID-19 pandemic. But the AEN and ENA knew that we needed to recognize this year's inductees, even if it couldn't be accomplished in person. An advantage of this virtual environment is that we have many more colleagues, family members, and friends celebrating with us tonight, and we welcome everyone. It is my distinct honor to congratulate this year's inductees. The nurses that we honor tonight have made enduring and substantial contributions to emergency nursing and will continue to provide the ongoing vision and leadership for our specialty and the nursing profession. Each of them has had significant involvement in ENA at the local, state, national, or international levels. Tonight, we are highlighting their enduring and substantial contributions to the emergency nursing specialty. Before we begin, I'd like to cover a little housekeeping. Please ensure that your microphones are muted, and please keep your congratulatory messages to the chat box during this presentation. We'll have an opportunity to congratulate the fellows at the end. And now, please join me in welcoming the following extraordinary emergency nurses as the 2020 Fellows of the Academy of Emergency Nursing. Valerie Arne Grossman. Ms. Valerie Arne Grossman has contributed to the advancement of emergency nursing through her significant publications and international philanthropy. Known as an expert in triage nursing practice and education, Ms. Grossman has authored several triage books and book chapters that have been translated into multiple languages and has donated significant quantities of her books both domestically and internationally to states and countries recovering from disasters. She has peer-reviewed over 150 articles and mentored over 80 professionals to shape the evidence base for the profession. Additionally, she has served on the New York Board of Nursing in multiple capacities, including being board president to ensure nursing education and practice meet standards of safe patient care. She is currently a nurse manager at the University of Rochester Medical Center in Rochester, New York. Valerie, welcome to the Academy. Terry Campbell. Ms. Terry Campbell's enduring and substantial contributions to emergency nursing include her international work in developing the first pre-hospital RN role in the country of India. She developed pre-hospital nursing protocols, safety training, and nurse competency training, all of which profoundly expanded the role of the emergency nurse, as they are now first responders to community emergencies. They arrive on medically equipped scooters significantly sooner than the ambulance. Ms. Campbell disseminated this and other information at the National India Emergency Medicine Conference. She has authored multiple peer-reviewed articles and chapter contributions focused on standards of care in emergency nursing and pre-hospital nursing practice. In addition to publishing, Ms. Campbell is an invited speaker at many state and national conferences. She served as the executive director of the Illinois Heart Rescue, an out-of-hospital cardiac arrest quality improvement, quality assurance project. This collaboration has quadrupled out-of-hospital cardiac arrest survival and tripled bystander CPR survival within Illinois. Ms. Campbell is the executive director of the Illinois Heart Rescue and a flight nurse with the University of Chicago Air Medical Network in Chicago, Illinois. Terry, welcome to the Academy. Paul Clark. Dr. Paul Clark's enduring and substantial contributions to emergency nursing focuses on research and dissemination of new knowledge. Dr. Clark has authored 11 Emergency Nursing Research Advisory Council publications and has served as an investigator on 10 research studies focusing on emergency nursing practice issues, particularly in the area of workforce psychosocial health. His publications have been cited approximately 300 times. Dr. Clark has also been a reviewer for multiple ENA clinical practice guidelines to ensure that the evidence supports the recommendations. Dr. Clark has published 22 articles, has given 26 podium and poster presentations at the regional and national levels. Dr. Clark is an assistant professor in the School of Nursing at the University of Louisville in Louisville, Kentucky. Paul, welcome to the Academy. Marianne Cosby. Dr. Marianne Cosby's significant and enduring contributions to emergency nursing focus on advocacy, policies, strategies, and intervention to lessen risks related to life-threatening emergencies that occur at schools, in addition to publications related to legal nurse consulting for other areas. Dr. Cosby served as the California School Nurses Association president and developed an evidence-based health-related program of simulation scenarios aimed at increasing the competence and clinical leadership skills for school nurses to handle life-threatening school emergencies. This program was integrated into the California School Nursing Credential Program and published by the California Simulation Alliance. She's received numerous awards from the California School Nurses Association for her publications and programs related to emergencies in school settings. Her work has empowered school nurses with the knowledge to provide best practice emergency care that aligns with ENA's practice standards, protocols, and guidelines. Dr. Cosby has also published over 15 chapters and other publications related to legal nurse consulting. She is currently a legal nurse consultant with MSC Consulting in Sacramento, California. Marianne, welcome to the Academy. Andy Foley. Dr. Andy Foley's enduring and substantial contributions include her wide publishing efforts to advance emergency nursing. Some of her most significant contributions among over 60 publications include being the Triage Decisions section editor for the Journal of Emergency Nursing, the co-editor of the 7th edition of Sheehy's Emergency Nursing Principles and Practice, and editor of the first emergency nursing certification resource published by McGraw-Hill. In all 3 roles, Dr. Foley engaged in strategy to develop less experienced authors to mentor and develop them through the writing, revision, and publication stages. The Sheehy's and McGraw publications combined totaled 34 first-time book authors. She is the clinical nurse specialist for emergency services at the St. Luke's Health System in Boise, Idaho. Andy, welcome to the Academy. Lisa Gilmore. Dr. Lisa Gilmore's significant and enduring contributions to emergency nursing have been in the areas of education and clinical practice. Dr. Gilmore has been an item writer for the Board of Critical Care Transport, American Association of Critical Care Nurses Certification Board, and Board of Certification for Emergency Nursing. She has authored chapters in ENA's ENPC Provider Manual and the Air and Surface Trauma Nursing Core Curriculum text. She has participated in and/or directed research on clinical practice issues related to the pediatric population and emergency nursing. Dr. Gilmore shares her expertise in the care for the pediatric patient while working with the EMS for Children Committee and the Pediatric Trauma Society Advanced Practice Provider Committee. She has over 20 publications and has given over 44 presentations at the regional and national levels. She holds multiple advanced practice registered nurse positions in Arkansas and Missouri, and is the owner of EMT2DNP Services, a clinical education, consulting, and clinical practice organization. Lisa, welcome to the Academy. Vanessa Gorman. Ms. Vanessa Gorman's enduring and substantial contributions to emergency nursing focuses on leading and developing 2 statewide nurse-led clinical pathways for emergency department nurses on the detection and management of deep vein thrombosis and short-stay unit patients in Victoria, Australia. She also took on a leadership role as the state trauma manager, where she created a pediatric trauma nursing management course for rural and remote nurses. She was then appointed to lead the Department of Health-led project on the implementation of new statewide trauma guidelines for Victoria, Australia. Ms. Gorman was inducted as a Fellow of the College of Nursing Australasia in 2017 for her pioneering work in emergency nursing. She is the Emergency Service Nurse Unit Manager at the Royal Women's Hospital in Melbourne, Australia. Vanessa, welcome to the Academy. Sandra Houston. Ms. Sandra Houston's significant and enduring contributions to emergency nursing focus on her advocacy for advancing advanced practice courses and practice skill sessions into multiple nursing organizations. A teaching professor at BYU for more than 15 years, she has mentored over 2,000 student nurses while advocating for emergency nursing and the importance of professional organizations. Ms. Houston has led many study abroad experiences and is currently focusing on pediatric community health projects in Paraguay. She is an expert in emergency nursing, palliative care, nursing education, and a variety of clinical nursing topics. She's published 32 articles, chapters, and reports, and presented over 30 poster and podium presentations locally and internationally in the areas of her expertise. She is an associate teaching professor at Brigham Young University and maintains an active advanced practice role in urgent care. Sandra, welcome to the Academy. Daniel Nedwardy. Dr. Daniel Nedwardy's significant and enduring contributions to emergency nursing have been in the areas of emergency preparedness and public policy advocacy. As an active member of the Trauma Critical Care Team, a division of the National Disaster Medical Services, he has deployed to major disasters globally. He has conducted research on emergency nurses' knowledge and experience related to emergency preparedness, which demonstrated a gap in their knowledge and preparedness. He's consulted on major disaster events around the world, including Paris, Australia, Japan, Orlando, and Boston. In the area of public policy and advocacy, Dr. Nedwardy has worked with legislatures on workplace violence, nurse staffing, and opioid legislation. Through his public policy and advocacy work, he's been able to represent emergency nursing. Dr. Nedwardy is the Director of Emergency and Patient Care Services at Beth Israel Deaconess Milton Hospital in Boston, Massachusetts. Dan, welcome to the Academy. Nicole Oliver. Dr. Nicole Oliver's significant and enduring contributions to emergency nursing on the role of the advanced practice nurse in the emergency department. That's her focus. She's been honored twice for the ENA Frank Cole Nurse Practitioner Award. Her contributions to the refinement of the APRN ED practice include authoring 2 chapters in a nursing textbook on graduate degree prepared nurse professional development. And she's delivered 20 advanced practice clinical focused presentations at regional and national and international conferences. The position statement for APRNs and the emergency nurse practitioner competencies were completed under her leadership. Dr. Oliver is an advanced practice registered nurse in multiple health systems in Oklahoma and Arkansas, and she's an instructor in the DNP program at the University of South Alabama. Nicole, welcome to the Academy. Lynn Sayer Visser. Ms. Lynn Sayer Visser's significant and enduring contributions to emergency nursing have been in the areas of clinical practice and publications. In the area of clinical practice, she has been influential in the redesign and implementation of triage processes and education. She redesigned the triage processes throughout a 25 hospital system. She is recognized as an expert and consults on redesigning and implementing new triage facilities, computer systems, processes, and education plans. Through her publications, she has shared her expertise in triage with nurses around the world. She's authored or co-authored 5 books related to triage and other emergency nursing topics. She has also contributed to several other nursing books and published articles in several professional nursing journals. She co-founded and edits the very popular Journal of Emergency Nursing blog On the Other Side of the Rails that has received nearly 1 million hits in its first 8 months. In 2019, she received the Sigma Theta Tau International Edith Moore Copeland Founders Award for Excellence in Creativity, as well as the ENA 2019 Media Award for her book, Fast Facts for the Triage Nurse, an Orientation and Care Guide, the 2nd edition. She's donated over 500 books to 50 states and 6 countries. Lynn, welcome to the Academy. Alyssa Wood. Dr. Alyssa Wood's significant and enduring contributions to emergency nursing focuses on research and evidence-based practice concerning the care of vulnerable children. As the recipient of 5 research grants, she has worked to improve pediatric care through the creation of a sensory-friendly ED, identifying disparities in knowledge between Spanish-speaking parents and English-speaking parents, and created award-winning Spanish language video discharge instructions. Dr. Wood has 7 podium and poster presentations at the local, state, and national levels, and has published 8 articles in GEN and other international journals. Dr. Wood is a professional lecturer in nursing at the George Washington University School of Nursing in Ashburn, Virginia. Alyssa, welcome to the Academy. These are our 2020 Fellows of the Academy. At this time, I would like everyone to unmute your microphone so that we can all give our fellows a virtual clap and a wave and welcome them to the Academy. I know you can't hear that very well, but everyone is clapping for you, our new fellows, and we're proud of you. Thank you and congratulations to the 2020 Academy class of fellows. I'd now like to welcome 2020 AEN Academy Chairperson-elect Garrett Chan.
Thank you, Vicki. What an incredible class of fellows. Congratulations and welcome to the Academy of Emergency Nursing. I'd like to thank all of you for attending this evening's ceremony. Because we are unable to celebrate in person this year during AEN Emergency Nursing 2021, the Academy would like to invite all of the 2020 inductees to next year's ceremony and for a special celebration in person recognition. Thank you, and please enjoy your time during EN 20X. And I just want to, again, give my warm welcome to all of the new inductees. As a reminder to the fellows, including all of our new inductees, our State of the Academy meeting will begin at 6:30 this evening Central Time. There was a separate Zoom access code for the State of the Academy meeting, and you can get that Zoom access code through either ENA Connect or via an email that was sent to you. So again, congratulations and welcome everybody to the Academy.